GETTYA leading doctor believes the chaos experienced in hospitals could be avoided. Dr. Mark Holland claimed the chaos that has seen patients waiting hours in ambulances and in hospital corridors could have been avoided. Senior managers should consider resigning due to their consistent failure to plan properly against a predictable winter crisis, he said. He also claimed doctors were being told to take risks by discharging patients from hospital prematurely to free up beds as record numbers of seriously ill people waited to be seen in accident and emergency departments. His comments came as figures revealed the number of patients visiting ER rose by 1.9 million during the past 5 years to record 23.4 million. The total waiting for longer than the 4-hour target increased five-fold to 560,093. GETTYA Theresa May visited Frimley Park Hospital in Surrey and apologized for cancelled operations. Theresa May needs to put her words into action and do something about it rather than just apologizing. She needs to make sure it doesn't happen in the first place. Jesse Hurst. Dr. Holland, former president of the Society for Acute Medicine, criticized the decision by NHS bosses last week to cancel 55,000 non-urgent operations. NHS England and NHS Improvement say there has been lots of planning for the winter, but over the last 2 to 3 weeks we've seen the annual flu outbreak and increasing numbers of people with chest infections, and we are now having to tell people that we need to cancel the surgery. That's not planning, it's a knee-jerk reaction. It's shambolic, he said. Why are we making important decisions such as cancelling surgical work in the middle of a crisis? These managers just do not learn. Of course there will be increased pressures at this time of year, but with proper planning we wouldn't need to experience the annual winter crisis. GETTYA Theresa May spoke to staff and patients during her visit to the hospital. Added, managers are now telling doctors who do ward rounds to take more risks and get people out of hospital prematurely. People are suffering and not being cared for properly. They are being treated in public corridors and cupboards, in mixed-sex wards. Decades of quality has been binned. Simon Carley, a professor of emergency medicine in Manchester, said the NHS could have been far better prepared for this winter. Apologies from the government about the air waits and cancelled operations will do little to help the resulting suffering and injuries to patients. Health think tank The King's Fund discovered the record 1.9 million rise in visitors to air departments last year, up almost 20% on 5 years ago. The research showed this is not the worried well, but people with serious illnesses who were later admitted. It comes after the death of Josephine Smalley, 88, who waited 5 hours in an ambulance and 2 hours on a trolley in a hospital corridor. She was at her home in Southsea, Hampshire, on December 30 when her son, Christopher, 55, called an ambulance after she had begun struggling to breathe. It took an hour to arrive. She died 26 hours later on New Year's Day at the Queen Alexandra Hospital, Portsmouth. Her granddaughter Jessie Hurst, 27, said at the time, "We're devastated. She should have been at the top of the list." Mrs. Smalley was left on a trolley in a corridor between 6 a.m. and 8 a.m. before being moved to a bed in the hospital, which declared a major incident over New Year and issued a plea for staff to volunteer for shifts. GETTYA number of people visiting ER rose by 1.9 meters during the past 5 years to 23.4. MSAG suffered a stroke and heart attack at about 5 p.m., which was treated with aspirin. Prime Minister Theresa May last week apologized to patients for delays and cancelled operations, but Ms. Hurst said she needs to put her words into action and do something about it rather than just apologizing. She needs to make sure it doesn't happen in the first place. Portsmouth Hospital's NHS Trust was unavailable to comment. In a previous statement it said Mrs. Smalley was assessed within 4 minutes of arrival and that her condition was monitored. GETTYA total number of people waiting longer than the 4-hour target increased five-fold to 560,093. The South Central Ambulance Service said, "We will be carrying out a full investigation into Mrs. Smalley's death and her family will be fully involved." Separate figures show more than 1 in 8 patients taken to hospital by ambulance this winter faced a delay of more than 30 minutes on arrival, although they are meant to be handed over to staff within 15 minutes. Some of the worst waits last up to 5 hours. In addition, almost 500,000 patients called the NHS 111 helpline last week, the highest number ever. Health leaders said the pressures on the NHS were intolerable and called for a funding solution, but Dr. Cliff Mann, NHS National Clinical Lead and past president of the Royal College of Emergency Medicine, said, with support from the NHS nationally, hospitals, GPs and ambulance services across England have in fact prepared extremely thoroughly, given the constraints and real pressures the NHS is facing. They and their staff deserve our thanks and support. NHS England last month told hospitals to delay operations, such as cataract removals and hip and knee replacements, until mid-January. The only exceptions to this are cancer operations and what the NHS called time-critical procedures, where the surgery has to go ahead to avoid the patient's condition deteriorating. Further, Thursday, February 9, 2017, it has also instructed NHS trusts already experiencing high levels of operational pressure this winter to convert clinics and areas usually used for day case surgery into overflow areas with beds to reduce the risk of running out of space for patients. The situation threatens a repeat of last winter, when some hospitals had to turn gyms and storage areas into temporary wards as increasing numbers of patients had to wait hours on trolleys in corridors or in ambulances before being given a bed. Professor Derek Alderson, president of the Royal College of Surgeons, said at the time, cancelling planned surgery is not a sustainable way of dealing with emergency pressures. Putting aside today's short-term measure, we urgently need a wider look at how we can protect planned surgery and hospital bed capacity for the future.